American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to the American Health Journal. I'm your host, Roger Cooper. Today we have 6 reports that may help you improve your health. First up, a facelift in less than an hour and no general anesthesia. You don't want to miss this one. Doing a facelift in about an hour while the patient is awake? It sounds alarming, but not for a Beverly Hills plastic surgeon who named the surgery the Simoni Lift. We asked Dr. Payman Simoni about this unusual but successful procedure.
Commonly, when people think about a facelift, what they think about is 5 hours, 6 hours under anesthesia. They have a tube down their throat. They're going to be swollen for a few weeks. They have to hide in home. They can't show their face to anybody else. And when they come out, they're going to be sometimes tight, look like somebody else, and shows that they had a facelift. That's a common concept of a facelift between people. However, what I did was with Simoni Lift, I took all the bad ideology that is people's head, and it is some of them true, from facelift. I took them out, and I tried to create a Simoni Lift without the negative sides of it. One of the main parts that I took out was anesthesia. I took away major anesthesia from the facelift, and that makes a huge difference between Simoni Lift and other facelifts. Instead of 5 hours going under, it's only 1 hour. Instead of being 2 weeks hiding in home and look like a pumpkin and black and blue and swelling, 4 to 7 days, and people can go back to work. What I do is I create a technique that I can numb up the face in a very gentle manner. The key to that is being tender, use small needles, and being slow to inject. And my injections are a style that is not a burning type injections, because most of the injections that we do is already pre-made outside, and they are very acidic and it hurts when they inject it. What I do is I make my own injections. I mix my own fresh, so it's not burning. So discomfort is as minimal. My patients tell me that the amount of discomfort they had is less than getting their teeth cleaned. The first thing is I make sure that the patient is relaxed. They're going to come into the operating room, and my surgery room and operating suite does not look like a regular operating room, because I don't want people to feel that they walk into the operating room. It's a very spa-like place. So that's the first thing that calms people down. They don't feel like they're having a major procedure done. When they sit down, and most of the procedure is done as they're sitting up, they are not lying flat. When they're sitting up, I'm slowly numbing one area, and I'll talk to my patients during the same time. I enjoy talking to them. After I numb the area, I'll make my incisions, and at that time they don't feel nothing because everything is numb. I like to talk to my patients for 2 reasons. One thing, I like to communicate with them. The second thing, which is the most important one, I want to see their movement of their face during the procedure. That is not possible when we do a facelift with major anesthesia.
I'm having his procedure where he's going to tighten up my neck and my jawline, and I think maybe even more up here, and he may do a little something to my lips.
Here you are.
Oh, my heavens, look.
This is gone.
Oh, I know.
Neck is nice and tight. The cheeks is higher. And when a patient's sitting up, not lying down, and talking to me, I can see the face in its natural state. I can see them while they're talking to me. And when I move the face, I move it in a natural position. It takes complete guesswork out, so patients look natural. My best compliment is that the person comes in and says, I would see my friends, and none of them tell that I had a facelift done. They just think I went to a vacation and I feel refreshed. I changed my hair, I changed my makeup. They think that I look great, but they can't put their finger on it. And that's the best compliment I get from my patients.
You're watching the award-winning American Health Journal.